One of the conditions that we treat in this office a lot, in fact, this is probably my favorite thing to deal with patients, is headaches. I don't know that I've ever found a patient that couldn't get beyond their headaches if they did the right thing. The problem with typical care for a headache is that people have a tendency to focus on the pain. Of course, that's what headache pain is. But if you understand that there's a root cause to creating that pain, in other words, why is there pain there, and you eliminate that why, then it goes away all the time. I can't say that I've been stumped. Occasionally you'll have somebody that, like I said, might have a tumor in their head that you send to the neurosurgeon, but that is so rare, it's crazy. So when we have a headache patient and they come in, the first thing that I do, and I tell these patients, now this is going to scare you a little bit, but when I start working on you, and I've assessed the patient with exercise or X-rays and exams and all that kind of stuff, I'm trying to identify what's causing the headache itself. The body is wired, it has a nervous system. We know that the muscles, or the nerves down the low back, aren't going to cause a headache. We know that there are certain nerves that cause most all headaches, like trigeminal nerve, like for TMJ problems, and the first three nerves in the neck, they go over the back of the head to the forehead, and they create headaches. But when I start assessing people, the very first visit I have, and I work on them, one of my favorite things to do is to tell the patient, now I'm really excited, I hope you have a headache. Because if you have a headache today, I can try to make it so it changes. If I change it, then I know that I'm in the right area. I know that I'm dealing with something that's right. Depending on where the headache's at, whether it's right side or left side, or it's in the eyeballs, that tells you neurologically what nerve system it has to be reflected by. It's always a nerve that's going to create a head pain. And when you take in, start treating a patient, if they don't have a headache and you give them a headache, that's even more exciting. Because then all of a sudden the patient knows they came in having headaches, but they don't have one today, and they look at you and go, I didn't have one when I came in, but now I have one. I don't like that. And I said, I love that, because I just took and affected what's causing your problem. Again, if I have a splinter and I have to dig it out and it hurts more, I'm okay with that. But if I take and try to avoid pain, pain's not the problem in a headache. The problem is causing the head pain. And we have to identify areas that the neurological system gets compressed that typically will create a head pain. The trigeminal nerve is the fifth cranial nerve. That nerve it has branches down, goes to all your teeth, goes to all your sinuses, goes up by your temples, and it has a branch that goes all the way back to the first three nerves in your neck. Those first three nerves, those are suboccipital nerves, they go over the back of the head, the forehead. They talk to each other in a ganglion or a synapse in the brain. When people chew gum, that's probably one of the number one triggers of headaches. Gum chewing is repetitive. When people chew gum, they almost always chew on one side of their mouth. I'd have to take every headache patient and say, if you chew gum, you won't be my patient. Because if you chew gum, you're chewing on one side of your mouth, that develops or overdevelops and tightens the muscles of the jaw. The trigeminal nerve goes between the ramus of the jaw, which is like the thing that moves here, and your ear canal, and it's a branch that goes right in there. There's a little space there. Anytime that you take and have the gum chewing, your mouth, when you open it up, will move sideways. When it moves sideways, it's going and irritating that nerve. That nerve itself then will take in and give you a headache that it can make you nauseated because it's a cranial nerve. It can take and give you, in fact, I'd have to say probably 90% of the migraine headaches that people are diagnosed with, they're diagnosed because of the intensity of the head pain itself. But when you take and look at a migraine headache is a vascular headache, and it's almost impossible to have a migraine headache every day. You'd stroke probably, because migraine headaches let blood go into the head but not blood come out. Trigeminal nerve is one that people affect a lot, because if they sleep on their stomachs, then they're pushing their jaw sideways. Then that nerve, and that's the biggest sensory nerve in the whole upper body, is the trigeminal nerve. People, like if somebody gets a virus in that nerve, that's called tic douloureux. And people have committed suicide because it's such a horribly painful thing. If you have an abscessed tooth, that's your trigeminal nerve. When the dentist takes and goes in and gives you a shot in your mouth, he's sticking a needle in that nerve. When people, I have people that will go to the dentist to have their teeth cleaned, and they'll come back and they'll have a headache. Why? Because they've taken their jaw that only opens so far, and they'll open it beyond the normal capacity. That strains the capsule, the muscles tighten up, and it ends up giving them a headache. And so then I teach them how to stretch their jaw before they go in before dental work. When you take and eliminate pressure on the nerves in the back of the neck, like if you have a misaligned bone in your neck, that can give you a headache. Or if you don't stretch and the muscles in the back of the head tighten up, that can squeeze the nerves going through there as they go through there up to the head, and that can give you a headache. So there's so many different reasons why. I mean, you could take and have headaches from not drinking enough water. There's always a cause. And that's the fun part about headaches, is because to get to the why, if you can quit focusing in on what kind of medication you need, and if you can take and show somebody, if I can take and give you 5% change, 10% change, if you can see any kind of a difference in your head pain when I'm treating you, I can take and usually get rid of it. Why? Because I've affected it, and I know what nerve it is, and I know how to go after taking and eliminating the irritating pressure on it. How about you?
Yeah, it brings up a memory for me. It was probably my first year in practice. A long time ago, I had a patient that came into the office here that she was a probably late 30 age female. Her primary symptom, primary complaint, which is very typical in an office like ours, was of course headaches. She was getting very significant headaches. When she first came into the office, she was really sensitive to light, kind of very typical presentation of something like a migraine or a very significant headache. My staff took her back into the office, or into the treatment room, for just a brief question and answer session before I came in to assess, and quickly found out that she wanted an adjustment because she had headaches. So I walked into the treatment room, introduced myself, we started to go through an assessment process, and something just didn't seem right to me. It was not a circumstance that I felt great about. So I called my staff to come in and take her blood pressure. She was laying down on the table, put the blood pressure cuff on her arm, pushed the button. Before we knew it, we had a reading on that blood pressure cuff of nearly double what it should have been. Her headaches were not a result of any of the types of things that we would typically treat in our office. I told her pretty immediately, we're going to send you down to the emergency room just down the street here. So she went in there and was triaged to find that she had very significant hypertension and that her kidney function was really struggling. So all of that is just to say there are so many reasons why headaches can occur, and instances like that are very rare. They don't happen very often. But to have a doctor, have a chiropractor that has those things on their radar and make sure that you get what you need, not what just happens here in this office, is priority number one. Most headaches we're able to help very significantly, if not completely, as Dr. Hill just stated. But keeping the radar on to make sure that we're aware that there are other circumstances where headaches can be a bigger deal than what we typically would treat in this office is very important.